Yes, same group.
Is that right?
Happy people group and power team.
All right, sir.
Let's go
So
ahead.
I'll be giving this lecture using these following objectives. At the end of this lecture, I expect that we'll know what the prostate is. We'll know how friendly or how useful the prostate is. We'll also learn the prostate as a foe, that is, how problematic the prostate can be when it becomes diseased, causes of these problems, how prostate problems present, what we call the differential diagnosis, that other things that can mimic the prostate disease, the complications that can arise from prostate problems, and then, of course, discuss a few of the myths about prostate diseases, the treatments, and then you know how to do a proper check for prostate cancer. This is what I expect that at the end of this discussion we would have all learned. So that's our learning objectives. By way of introduction, prostate gland, it's very important in man. As a child, you're a male, you are born today, you are born with prostate gland. Often a time, I'm in my clinic, people will walk in and say, "Doctor, I have prostate." So normally, it's normal for you to have prostate because from birth, we all have prostate because it does something in us. So it's not like it becomes prostate only when it is diseased. From birth, as you are born today, we all have prostate glands. Prostate diseases and their pathology are some of the commonest disease entities in men. Prostate cancer is the commonest cancer in men worldwide after skin cancer, all over the world. In Nigeria, in US, in UK, in Ghana, wherever it is said to be second commonest. In Nigeria, actually, prostate cancer is the commonest in men. As one ages, prostate pathology develops. So it is said that at age 60, if you bring 100 men, 50 of them will have prostate pathology, especially prostate enlargement. For men 60 years and above, gather 100 people in a room, 50% of them, up to 50 of them, will have prostate enlargement. As you age further, the incidence or prevalence increases. So at age 85, if you gather 100 men, or let's say 10 men in a room that are ages 85 and above, 9 of them have enlargement of the prostate. Only 1 would have escaped the risk of developing prostate enlargement. That is how common prostate disease is. For prostate cancer, the commonest incidence of prostate cancer have been found to be amongst African Americans, where it is thought that in 100,000 men, 249 of them will have prostate cancer. And then the lowest incidence is amongst Asians, where it's thought that the same 100,000 people like we have in African Americans, 100,000, only 1.9 of them will have prostate cancer. Just compare it to 249 as against 1.1 in Asia. You will now ask yourself, what's the cause? What's the difference? Studies have shown that in Asia, they are mainly vegetarians. They eat a lot of fruits and vegetables, less of our meat. In African Americans, they eat a lot of junk food, a lot of meat. So it is thought that these things increase the incidence, while fruits and vegetables reduce the incidence. So Asians have less cancer of the prostate because of this particular thing I just described. Billions of dollars are spent every year on researches concerning prostate cancer. It's been known to be a global problem. As we speak, people are doing research on prostate cancer because it's killing men. Prostate as a friend. Like I said earlier, one is born with prostate. That is, as once you are born today, you are a man, you have prostate. The prostate gland surrounds the urethra. This is the bladder where there is a urine passes through this hole and goes out through the penis. This is the penis. You pass urine in trickles. This is the prostate gland surrounding that tube that takes urine from the bladder to the exterior. Now, the prostate aids in production of 1/3 of semen. We call it sperm. 1/3 of the sperm you see when you ejaculate is produced by the prostate. 1/3 of it. So if you divide the sperm into 3, 1/3 is for the prostate. The prostate also helps in producing substances like zinc, citric acid, which helps in nourishing the sperm that will release as men. Now, when the sperm is released naturally in every man, it comes as a sticky and thick liquid. It comes as semi-solid form. The idea is for the sperm to be shot to the posterior wall of the vagina, because the main job of sperm is for fertility. So God created it in such a way that it's semi-solid, so that if you throw it out, you throw it out like a bullet, and it goes to the posterior vaginal wall. But it comes sticky and thick. In that circumstance, the sticky and thick form, the spermatozoa that does the fertilization will not be able to move. It will just be like somebody moving in the mud. So there's a substance released by the prostate called PSA, prostate specific antigen. It's an enzyme. It helps to lyse that sticky and thick nature of the sperm to make it ordinary water. It becomes very light like ordinary water, so that the spermatozoa that does fertilization will now be able to swim out of the sperm easily to go and do its job, which is fertilization. So this is the main job of the prostate. 1/3 of sperm. 2, production of zinc and citric acid. 3, to dissolve this sticky and thick substance that is released by men, to allow the spermatozoa to swim out to go and do its actual job. Now, prostate as a foe, as an enemy. Prostate only becomes an enemy when it starts to increase in size. And this happens naturally as we age. If you remember our first slide, I said, as we age, the prostate starts to increase in size. At 65 years, about 50% are big in size. At 85, up to 90% of our prostates are big in size. What brings about this increase in size? 1, I've said aging. 2, the prostate just continues to increase as we feed, as we are growing, the prostate is also growing. So it gets bigger. As it gets bigger, it squeezes and blocks the urethra. As it gets bigger, it squeezes and blocks the urethra. Now, this is a diagram I drew for this lecture. Now, urine comes from the kidneys. These are the kidneys. Urine comes down from the kidney into the bladder. And then from the bladder, urine passes directly through this channel. These are the prostate glands. You can see how wide open this place is. But as we age, from 40 years upward, the prostate will start to increase in size. As it's increasing outwardly, it's also increasing inwardly. As it's increasing outwardly, it's also increasing inwardly. By so doing, blocking that lumen that allows urine to pass. What are the things that can bring about this increase in size of the prostate? Because we have noted that it is just the increase that brings about this narrowing. The normal size of the prostate is 18 to 22. Some prostate grows as high as 480 grams, even up to 500 grams. So as one ages, the prostate increases in size. So what are the things that bring about this increase in size? 1, infection of the prostate. We call it prostatitis. 2, ordinary enlargement of the prostate. And then 3, prostate cancer. So there are 3 major problems or pathology that can arise by the increase in size of the prostate. One of the things that causes that increase in size is infection. The next one is just ordinary growth of the prostate enlargement. And then the last one, which is the most dangerous, is prostate cancer. This is prostate as a form. This is just in line with what I described earlier. This is a normal bladder, normal prostate, and then urine passes through this channel. You can see this prostate it has not blocked this channel yet. If you can see well, it has not blocked this channel yet. But as it grows, it has formed a ball that is now blocking the channel. So urine comes and bounces back. The urine that is supposed to flow downwards is now bouncing back. And of course, we can have some obstruction to urine flow. What is the actual etiology of this growth? Yes, we know a few of them. They vary. And a few would not know their actual etiology. So, etiology of prostatitis, which is prostatic infection. This is just infection of the prostate gland and is commoner with younger people. People 40 and 30, if you tell me you have problem with passing urine and your prostate, I'll be thinking of prostatitis, prostatic infection. It is not your regular toilet infection. But often a time when we as doctors say there's an infection, sexual infection, you say, no, you don't go to public toilet. It's not related to public toilet. It's just an infection that can affect the prostate. And like I had said earlier, it is commoner in young people. What is the etiology of ordinary enlargement of the prostate, which is the benign form? Just enlargement. The commoner one is age. We have established that the older you become, the more the risk of enlargement of the prostate. Up to 15% of enlargement runs in the family. I have seen a family of about 4 or 5 men, all of them have prostate enlargement. Their father had prostate enlargement. The first son up to the last, about 5 of them. So this is a familiar kind of enlargement of the prostate. There are a few diets we consume, like we had said earlier. Fruits and vegetables should protect us. All these junk foods they don't protect us. Diabetics, those who have diabetes and some of the drugs they take have been found to be predisposable to developing enlargement of the prostate. Those who have heart diseases, hypertension, and the likes, who are on beta blockers, have been known to increase the risk of prostate enlargement. Our lifestyle, obesity increases the risk, while exercise up to 30 minutes every day for up to 5 times of the week lowers the risk. Sincerely, in the treatment of malignancy generally now, WHO have recommended that people should do exercise, even if it is brisk walking, 30 minutes every day for up to 5 times in a week, known to be protective against most enlargement and most malignancies. Cancer of the prostate. What I said earlier, the actual etiology is not known, but we have said up to 15% of them runs in the family. What are those factors that increase the risk? These are the factors that increase the risk. You are born a male, there is naturally a risk factor. You get older from 40 years upward, there is a risk factor. The fact that you are born a black man, like what I said, the commonest incidence among Black Americans. The fact that you have black skin, there's an increased risk of prostate cancer. Those who consume up to 500 grams of meat, red meat per week, they have increased risk of prostate cancer. Obesity, eating burnt, charred food, grilled meat, smoked, pan frying kind of meat, they are increased risk of prostate cancer. We'll explain this to us in due course. I have said 15% of prostate cancers run in the family. What are those things that we can ask ourselves? Please, most people say, doctor, what will I do? What will I eat to reduce prostate cancer? The risk. Fruits and vegetables. We'll keep hammering this. We have found out that the risk is far, far small in Asians. And one of the catchy thing there is the fact that they are vegetarians. Tomatoes. Eating a lot of tomatoes, carrots, soya beans, green tea have been known to be protective or to reduce the incidence of prostate cancer. Eating fruits like pomegranate, which is not actually readily available, but is available. Broccoli is the kind of leaf consumed, in fact, they consume a lot of it outside this country. It's available but expensive in our environment. It's known to be an antioxidant and is protective against prostate cancer, or rather reduces the risk of prostate cancer. Some fishes like mackerel also protects us against prostate cancer. Now, I wanted to make this very vivid as it can be. So I had to get some diagrams. Now look at this burger with a lot of things inside it. This increases the risk of prostate cancer. This is like making our normal suya. As you roast, or rather put this on fire, the fluid from this meat drops to the open flame. That fluid that drops from the meat, as it gets to the flame, it gets burnt and rises up again as smoke. That thing actually is quite carcinogenic. That fluid that drops back and then comes up back as smoke is highly carcinogenic. It's a heterocyclic amine. It's been found to expose us to a lot of prostate cancer. This is not to say that we should stop eating suya or any of those roasted food. We can take them in small quantities. If at all we want to do them, let's not do them in open flame. And then, like we said, remember what we said is, if you take up to 500 grams of it per week, you are exposing yourself to the risk of prostate cancer. On the right of our screen, we now have a lot of fruits. You can see all the fruits on this screen. They will protect you against, or rather reduce, the risk of prostate cancer. Now, I decided to bring this particular page because these are things that are very, very much available in our environment. I know avocado pear has become expensive, but it's very much available in our environment. This is avocado pear, tomatoes, carrots. All these things protect one, or rather reduce the risk of prostate cancer. And they are readily available in our own environments. This is the broccoli leaf I was talking about. It's available, but very expensive. And occasionally when they come, they're not well preserved. But it's also been found to be very, very much protective against most malignancies, including prostate cancer. This is pomegranate seed. This one is actually scarce and very, very expensive. But if you have it in your environment, consume a lot of it. It's also very good to reduce the risk of prostate cancer. Exercise. We cannot talk too much of exercise. Exercise, exercise, exercise. The more affluent you become, the less the exercise comes. Those who have clubs, yes, they could help themselves go to play table tennis or whatever it is, play lawn tennis, go to your club, do brisk walking. The recommended dose of exercise is 30 minutes. 30 minutes of brisk walking per day, times 5 days of the week. Do this. We move from our house to one AC air-conditioned car. From air-conditioned car, we don't have time to move around again. Unlike in the olden days, where people trek a long distance, do a lot of things. Now we don't do anything again. We are always in one car, one AC room or the other. So we recommend we do 30 minutes of brisk walking per day for 5 times of the week. If you can do more, better. What is cancer? Why are we afraid of cancer? How does it affect us? That is the next thing I want to let us know. It's an abnormal, uncontrollable, excessive tissue growth. Can you hear me?
Yes, we can hear you.
Yes,
Love.
yes.
It's an abnormal, uncontrollable, excessive tissue growth. We will not say, why are we bothered about excessive tissue growth? Let it be growing on its own and we are growing on our own. No. As this happens, it starts to compete with us. It competes with us for space, it competes with us for food, and it competes with us for water. So if you eat 1 cup of rice, initially you take 10%. Over time, it will start taking 50%. Over time, it will want to take up to 70 to 80%. That is what cancer does to us. So of course, when it finds out that we are strong enough to fight for this space, food, and water, it starts to release toxins that will now make us weak so that it can take more of our food, more of our water, and more of our space. Over time, the person starts going down, cancer will continue to grow until death comes. That is how cancer affects us. So cancer, sincerely, is not anything good. How does prostate problem present? How do they present? Most prostate problems will start with nocturia. What is nocturia? Nocturia means waking up more than 2 times at night to pass urine. It's not like you are reading or you are watching one movie and you go to pee about 3 to 4 times. That's not nocturia. The urge to pass urine will wake you up from a deep sleep. Once it wakes you for more than twice at night, from when you sleep to when you wake up, there's nocturia. Rapid is frequency. Frequency simply means passing urine more than once in 2 hours. You are in a board meeting. Before the end of the board meeting, you've gone to void like 3 times. There's a problem with your passing urine. Urgency. Once the urge to pass urine comes, you can't hold it. If you hold it, you wet yourself. Bedwetting. This is mainly for elderly people. You see couple who come, man, 75 years, he say, look, my husband just started wetting the bed. He doesn't wet the bed before. There's a problem. Actually, what is happening in that circumstance is what we call overflow incontinence. So the bed wets. Somebody who has attained dryness before. The other symptoms that may happen, normally, once you go to pee, once you bring out your pennies, it just starts flowing. But when you have a prostate problem or most voiding problems, you get there, you have a delay in initiating micturition. So you wait some beats, relax a bit, and the urine starts flowing. So you tell them, look, you stop a bus, please stop me, I want to pee. You rush there, the thing doesn't start flowing. People have wonder, you said you wanted to void. It takes some time and you start coming out gently. So we say prostate is a disease of the gentleman. It comes out gently. So there's a delay in initiating micturition. Now, when the urine starts, the flow is so weak. Remember, as kids in primary school, they're able to direct their stream even up to the ceiling. As one ages, this stream drops. It's not natural for it to drop. It's the fact that the prostate gland is growing bigger and there's an obstructive problem. Some will not add some strain. They have to strain for urine to come. Some, while the urine is coming, it breaks, starts again. And then there's something we call terminal dribbling. After passing urine, one flings the penis, drops it into the panties, and the urine will have droplets of urine on the panties. So when you see a man, you'll be smelling of urine. Some, at the end of micturition, they will still look as if they have not really emptied their bladder. There's still urine in the bladder. And in some people who have total blockade of urine, this happens usually in fasting periods. And the reason is that that's when people take a lot of fluid, a lot of alcohol to enjoy. They have a lot of free booze. Once they overload the bladder, the thing blocks from the prostate. And then they will be rushed to the hospital or wherever. So this is the way most prostate diseases will present. In addition to that, we could have what we call abdominal fullness. Lower abdomen will be full. We could also have what we call early morning swelling of the face. this is when the kidney damage has started. Because, as I had described earlier, when one is unable to pass urine freely, some of those urine will now go back to the kidney and they'll be destroying the kidney gradually. So once the destruction in the kidney starts, one will start having what we call facial swelling or facial puffiness. Very early in the morning, when you see somebody's face to be swollen, but when it moves around the environment before evening, it would have become dry. Headache, which can be from the hypertension that can follow prostate enlargement. Leg swelling, blood in the urine, blood in sperm, pain on passing urine. For prostate cancer specifically, some people will start having low back pain, varying degrees of bone pain, loss of weight, asymmetrical leg swelling. You see one leg is bigger than the other. When that prostate cancer starts releasing those toxins I talked about, the patient will now be having problem we call anorexia. You will not be able to eat even when there is a lot of food around you. Inability to walk, loss of weight. Remember I said the prostate cancer will compete with you with food. So when you don't get enough food, loss of weight will start. Erectile dysfunction. You won't have enough erection to do your normal daily activity. Now, there are some other problems that can present this way. It is not like when you see any of these things, this person has prostate cancer, he has prostate enlargement. There are other things that can bring about this kind of presentation. What are these other things that can give you this kind of presentation? One is bladder neck stenosis, when we have tight bladder neck. Some bladder tumor. There's what we call urethral stricture. It's commoner in young men who have injury or gonorrhea in their urethra. So when it heals, it blocks the tube that allows urine to come from the bladder. So the person will also have problem with passing urine. It will not look as if it's prostate, but it's not prostate. People who have bladder stone, they also present as if it's prostate enlargement. People who have diabetes, they void a lot. Is it not? When they void a lot, they will look as if this is because of the fact that they have prostate enlargement. It just be because of the fact that they have excess sugar in their blood, so they are voiding more than they are supposed to void. So patients are given antihypertensive drugs that cause a lot of urination. So when they start those drugs, they will start passing a lot of urine and look as if it's prostate enlargement. It's not prostate enlargement. It's just a side effect of the drugs they are taking. This one in red is one I like discussing. Often the time people will come to my office and say, look, doctor, I'm passing too much of urine. There is just one particular question I always ask. We know we say, take a lot of water to clean up your kidneys. But garbage in, garbage out. If you take a lot of water, you pass a lot of urine. So if you take up to 4 or 5 liters of water, you pass a lot of urine. So if you wake up more at night, you have frequency and all those. You will not look as if you have prostate enlargement. But the major problem is that you are taking a lot of water. Once you scale down the water intake to the normal, that symptom will also disappear. So these are the differential diagnoses of those things that can mimic prostate enlargement. Complications of prostate enlargement. One of the most dreaded one is sudden inability to void. You wake up at night to void, no way. And then pain sets in. I understand that this is almost like the pain of pregnancy. I'm not too sure. I'm not pregnant. I've not been pregnant before. Neither have I had acute obstruction before. But we know that it's very painful. And people are rushed to hospital to relieve that obstruction. When you have enlargement of the prostate, it leads to have what we call recurrent urinary tract infection. But I've also said that because of the fact that when the urine packs so much in the bladder, some return to the kidneys, what we call back pressure, and they go there to damage the kidney, and the patient can develop kidney failure. Some will form bladder stones because of the fact that they don't empty their bladder completely. So those particles in urine will now start coming together to form bladder stones. Some could damage the bladder. And then if it is cancer, it starts spreading to other parts of the body. And of course, the will arise. These are the complications of the different forms of prostate enlargement. Now, this is the bladder. When it gets full and the urine cannot flow out this way, it returns back to the kidney to damage this kidney. So by so you can have renal failure. Now, this is a stone I got in a patient. This man was actually 83-year-old man I operated on some over 10 years ago. This is exactly the stone I picked from him. You know, this stone looks as if it's molded, but this is a stone in somebody's body. This is another stone I got from a colleague of mine, a medical doctor in whom I operated upon. I removed his prostate, and in the course of doing that, I found out over 20-something pieces of stone from him, and we removed all of them. These are complications that can arise from prostate enlargement. How do we investigate those who have prostate enlargement? We had said if they are not managed early, or if you don't take care of them early, over time they damage the kidney. So one of the things we do is to check kidney function. The other thing we can do is doing abdominal ultrasound scan. It will tell us how big the prostate is. Has it caused any damage? Is there any bladder stone? Is there any damage to the kidney? The ultrasound scan will tell us. We also do urinalysis. Urinalysis will tell us if there's infection in the urine and the other pathologies. Now, there's something we call prostate-specific antigen. I think almost the whole Nigerians, almost all of us will know about PSA. Everybody will just come, doctor, I did PSA, see what the value is. The value is 10. What will I do? This is one of the commonest things we use to check the state of the prostate enlargement, prostate-specific antigen. If it is high, a urologist will advise you to come for prostate biopsy. If it is high, a urologist will tell you to come for prostate biopsy. The biopsy will help us tell, is it cancer, is it infection, is it just underlying enlargement? If the PSA is normal, you don't have to do prostate biopsy. The other things we do, if we find cancer, to find out the extent of spread of that cancer, isotope scan, MRI, and CT scan, to tell us the extent of spread so that we know how to treat the patient. There are some myths about prostate enlargement, prostate cancer. So I want us to discuss them. Some patients will have elevated PSA. You say, look, I want to biopsy. They say, no, I heard that if you biopsy, it will spread. There's no such thing. No study has shown that biopsy increases the rate of spread of prostate cancer. Now, I had said there are 3 different types of prostate pathology. One of them is just prostatic infection. The second one is ordinary enlargement of the prostate, we call BPH. The third one is cancer of the prostate. Note that prostate enlargement does not lead to prostate cancer. That is, BPH does not lead to prostate cancer. There are 2 different prostate pathologies of the prostate. They are different entities. You can actually have prostate enlargement and prostate cancer together, but one does not lead to the other. Cancer is not related to too little sex or too much of sex. Often the time patients will come and say, look, doc, I hear that if you do a lot of sex, you won't have prostate cancer. It's not true. There is no such thing. Now, something that when their PSA is elevated, they will go to some place and say, look, I will give you a drug to make the PSA drop. That is not what we expect. PSA can drop to 0. The pathology remains. PSA is actually a surrogate. It helps us to dictate a problem. It's not the problem itself. So going to bring down PSA to 0 does not solve your problem. There's a disease of the prostate that made the PSA to rise. It's just like saying somebody has headache or fever from malaria. You just be giving drug to control the fever, to control the headache, instead of giving drug to control the malaria. So bringing down PSA does not treat cancer of the prostate. Rather, you should go and treat the cancer itself. Treatments. What do we do when we develop prostate enlargement? The first statement I will make is that it depends on what the patient has, and we could do drugs. Where drug fails, we could do drugs. Where drug fails, we'll go to what we call transurethral resection of the prostate, laser prostatectomy, or open surgery. For prostate cancer, we have early and late stage. Our prayer is to find it in early stage so that the patient can get cure. The cure can be in form of surgery or radiotherapy. If it's late, mainly we give drugs. Drug treatment for benign prostate enlargement. The common drugs we give is they are alpha-1 antagonists. We have 5 alpha reductase inhibitors. We have PDE5 inhibitors, and then we have phytoproteins. Phytotherapy, not phototherapies, phytotherapy. Phytotherapy are actually plant-derived or herbal drugs that have been found to be useful in the management of enlargement of the prostate or even some other diseases. These are commonly used in US. They are found in most supplements. The active ingredients in them are 1, saw palmito, selenolipins, cucurbita pepo, and then Pygeneus africanum. Now, I wrote saw palmito in blue because it's the most studied of all of them. The result from phytotherapy is not what I would call, it's not been found to, we have varying reports from them. However, saw palmito has been properly studied and we found to have some functions like some properties like inhibiting 5-alpha reductase inhibitor, which is a very good function. It's also an anti-androgen. It also has some anti-inflammatory properties. These are the things that have been found to be useful in the management of BPH. The other ones are still undergoing some studies, but it's been found to be useful, mainly used in US. This is a prostate gland I brought out in a patient some 10, 15 years ago. This is one we did when we were doing endoscopy. Screening. If there's any slide we must all pick as individuals, for our parents, our fathers, our husbands, for ourselves, it is this slide. For whatever type of cancer, and it's especially very important in prostate cancer. Once you discover this cancer early, you can get cure. So my advice for all of us is to commence screening of prostate cancer early. What do we do in screening? From 40 years and above, if you have a family history, you should be doing yearly PSA. We'll know what other things will do, but there are some people that should be going for screening. Those who have family history, any man that is above 45 years should go, and then for blacks, once you're above 45 years and you're black, you should be doing yearly screening. However, for people above 70 years, there's no need for prostate cancer screening. If at 70 years their PSA was good, most guidelines advise that patients must make a well-informed decision on screening. What do we do in screening? Remember I said, if there's a family history, from 40 years, you must start yearly screening. If there's no family history, you're a black man, from 45 years, you must do screening. What do we do in this screening? Yearly, you do PSA, prostate-specific antigen. 2, digital rectal examination by a urologist. Just once every year is enough. Once they are good, you go and package it, keep it in your file. Another year, you could do it on your birthdays. You just go and do all these screenings. If you find prostate cancer, it's a very lethal problem. But if you find it early, you can get cure. In conclusion, prostate cancer is currently a public health problem. Early diagnosis is our only hope for cure. Remember the emphasis, cure. There's a stage you find prostate that you can't do anything. But if you find it early, you can achieve cure. There's increased awareness on prostate enlargement, prostate cancer, and the likes. There's also a lot of fraud about prostate disease. Please beware. Thank you for listening.
Thank you, our Professor Dr. Tim Mbairi. Thank you so much, sir. Thank you. That's very, 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 very informative. We really appreciate you. I was speaking earlier and introducing our professor, not knowing, I was just gesticulating and a lot of people were not hearing me. Our doctor is an associate professor of surgery and deputy director, Center of Urology Studies. That's a university, Azikiwe Unizig, that's in Inewi. And as well, he is a consultant surgeon as well. And at the urologist Nnamdi Azikiwe University Teaching Hospital. And he's been vast, very vast in this area. Just like I said, that, we are taking this again just, to identify with the International Men's Health Month that is, we are still in, which is this November. And I believe that everyone has a male factor in their life, either their sons or their husband or their father or uncle. And just like, our doctor said it tonight, that we need to keep this light, we need to keep a tab on everything he has shared with us here, and in fact share it with our families. I believe is a give back. Like I said earlier, men, they contribute so much to the gross national domestic product of every nation. They said they are the head of the family, they are the head of the house. And like he said, this is a lethal thing that can happen and cause death. So we don't want it to be. Please, it's a good way for you to put as many emoji to say thank you, to say we love you, Dr. Tim, to say we appreciate you for sharing the time, for being here. Thank you so much, Doctor. Thank you. We really, really cherish and appreciate every information you have shared with us here this evening. It's been fantastic. Fantastic. Just like I earlier mentioned, the international men's health is very, very key. And like we all know, health, as defined by the WHO, says that is a state of complete physical, mental, social, and spiritual well-being of an disease or infirmity. So if a man is deficient in one way or the other, of course, you know that health is not complete. So for complete health tonight, yes, someone is saying, can we get the slide? You can get the slide. You will. If you talk to the person who invited you, let them know your email. I believe is going to be shared with the organizers of the event of this meeting. Thank you, Dr. Timothy. Thank you so much, Dr. Tim Uzoma Mbairi. Fantastic. He's been speaking since extensively on prostate gland. Prostate gland, is he your friend or your foe? Awesome, awesome. So I don't know if we have any questions. Maybe we'll be able to take, 2 questions for the evening before we call it a day. Yes, I'm getting questions that can we get a replay link? Oh, so sorry, you missed a lot of parts. Awesome. Yes, please let the person who invited you, let them know that you were part of the meeting and your email, and I believe the replay, the link will be shared with you for you to probably replay and look at. So our doctor, like I said, chief consultant surgeon and urology with Nnamdi Azikiwe University Teaching Hospital in Nnewi, has been awesome. He's been the one speaking to us on prostate gland. Is he a friend or a foe? And thank you everybody from where you've been watching and joining us from. I asked earlier if we could share where we are joining from, but pardon me, technically you couldn't hear me and I thought I was speaking to everyone. All right. So can you still hear me, please? Is there any question? If there are still questions, this is the time we can take it before we call it a night. Yes. Okay. I can see emails being shared already. Oh, thank you from Lusaka. Thank you. Wow. Thank you for being a part of the meeting. We appreciate you. Thank you, all our guests, for being a part of the meeting. Thank you from Ojota, from Kenya, from Zambia, from Anambra State in Onitsha. Wow. Thank you so much for making tonight a bright evening. Thank you from Songwater. Thank you. Thank you. All right. Is there no question? Should we call it a day? All right. Someone said, good evening, Professor. Thank you for the information. I think it needs clarification. You mentioned something on it affects the Black Africans. He says, please, can you tell me why is prostate only for the Black Africans? I think they just need more clarification regarding that, sir.
I don't
Dr.
think
Tim?
we said it's only for Africans. Yes, it's not only for Africans. We had
Yes,
said
sir.
earlier that up to 15% of prostate cancer run in families. All it means also the fact that it also runs in the gene. Now, however, we have also said that it is commonest amongst Black Americans. Black Americans, because they are Black, so they have some genetic predisposition. That's one. Then two, they eat a lot of junk food and the like. So amongst Africans, the gene itself, our genes predispose us to having prostate cancer. But it's not only enough, it's a worldwide disease, but it's commoner amongst Blacks because of genetic predisposition.
Yes, sir. Thank you so much. I believe that's clear enough. He had put much emphasis on that and says that it runs in the gene of most black races, basically. And if you also eat junk foods, yes. Thank you, doctor. Thank you so much, sir. Yes, a lot of people are asking for the recording. I believe the management team is taking note of that. So I want to specially say thank you again to the Power team and the Happy People's Group for putting this together. Indeed, you have impacted a lot of people, a lot of families, a lot of homes, and in fact, our nation here tonight, because I could see people from Canada, people from Mazubuka, that's Zambia, people from Lekki, different Enugu, Bonny Island. Awesome. People are just from all over the globe here tonight. All right. Help me. Yes, please still share as many emoji and let Dr. Tim know we really cherish, every moment he has spent here with us. He's been speaking since, and that's our own professor, Dr. Tim Uzoma Mbaeri, is the one that has been speaking on the topic prostate gland, your friend or your foe. Yes, okay. So can we take one more question, or we just draw the curtain for the evening? Okay. All right. Thank you, everybody. Thank you. So our speaker has been an associate professor of surgery, deputy director for the Center of Urological Studies, that's Nnamdi Azikiwe University, UNIZIK. And as well, he's a chief consultant surgeon and urologist with Nnamdi Azikiwe University Teaching Hospital, Nnewi. That's our professor par excellence and very vast in this topic. We won't mind. It's the best time for us to, share it with as many men in our lives, in our families. If you are a woman, it's the best gift you can give to every man around you, your father, your sons, your husband, your uncle. In fact, all right. So another question here, sir, before we call it a night. Please, sir, why is the PSA test? always required? Why is the PSA test? Okay, it said, why is the PSA test always gives infection?
The PSA
Yes,
is
sir.
produced by the prostate naturally. However,
Okay.
when the prostate gland becomes diseased, the rate of production increases.
Okay, sir. Okay, but he's talking in relative to an infection. That why does he always give infection? Can you still hear me? Hello, Doc. Can you still
Can you
hear
hear
me?
me?
Yes, we can hear you now, sir. We lost the line a bit.
Yes.
Yes, it's talking in relative to infection.
Like,
Infection.
yes.
Yes, I said, why is the PSA
Please, the
test
question again.
always gives infection?
Let me hear your question again, please.
Yes, sir. He said, please, sir, why is the PSA test always gives infection?
The PSA does not give infection. However, prostate enlargement and blockade of outflow of urine can predispose one to having recurrent urinary tract infection. And why is it so? The way we were created, the bladder is a reservoir for urination, for urine. So when we find a convenient place to pass urine, we empty the bladder. So in the course of trying to empty the bladder, it flushes and cleans up the tract. But when the urine flow through that tract is not adequate, it doesn't do that flushing enough. So infection or bacteria can grow and then develop infection in men. That is why it can predispose one to having recurrent urinary tract infection. PSA on its own is a normal enzyme produced by the prostate. However, in disease states, infection, enlargement of the prostate, or cancer, the production increases. You might not understand the technicalities. When the prostate gland or other prostate cancer breaks some of the barriers in the prostate, so that PSA leaks to the system. So it increases in the system. So when we test for PSA and we find out, look, this is PSA has increased, we now know there's a problem with the prostate, and we have to go and search for that prostate, for the prostate problem. And that's when you now start doing prostate biopsies and the likes. And the common thing that caused this increase in PSA are these three pathologies you have mentioned: the infection, the ordinary enlargement, and then the prostate cancer. But more importantly is the prostate cancer. So once we see the PSA is high, we want to go and search to make sure the person does not have prostate cancer. Because our target is to catch the cancer early so that we can give the patient cure. Unlike when you come late, we can't do much again. We just give some palliation, some drugs, and of course, that's not wonderful. The best time to get prostate is when it is still early so that the patient can get cure. That's why we advise for screening once every year. That's just what you need. Once every year. Do your PSA, do a DRE, and you're done.
Yes, sir. Yes, sir. Thank you so much. So, man, please take note. Do your PSA test yearly and you are done. It is better to curb it faster than when you just get a palliative measure and, of course, go into hospice. All right. There's a question, one more for the evening, so that we'll be able to call it a day. A lot of people have been saying thank you to you, doctor. Thank you so much. A lot of people are saying thank you. Very brilliant rendition. Very simple to understand. Everyone has been saying just that. All right, one more question for the evening, and that has been on T. The person is asking on a TURP. TURP. He's saying you mentioned TURP. What is it?
Now,
And what's the normal level of PSA?
Let us start with the normal level of PSA. The normal level of PSA is between 0 and 4.
Yes, sir.
Between 0 and 4. However, depending on the patient's age, if I see an elderly man, let's say 70 years, and your PSA is 7, I will not bother you. Or I see somebody who is 7 and the prostate gland is as much as 300 grams. I will not bother the patient. So the first thing is to know that for a normal person, PSA is to be less than 4 nanograms per ml. However, between 4 and 10, there are things we look at that will make us decide what next to do. But once they both 4, there's a problem somewhere, we should look for it. It can be addressed. Now, what is TURP? TURP is transurethral resection of the prostate. Before, let's say 10 years ago in Nigeria, if you have prostate, we must cut you open to bring out the prostate. No matter how it is, we must cut you open. But currently, we don't have to cut you open again. There's a machine we can go into your penis and we'll suck out your entire prostate, and that's done. No knife cut on your skin. In 2-3 days, you go home. That's the procedure we call transurethral resection of the prostate. We are going through the urethra, transurethra, going through the urethra, resection of the prostate, bringing out of the prostate without a knife cut on your skin. That's what TURP is. It's a minimal access surgery, less trauma, less trouble, less problematic, less complication. It's very safe to remove out the prostate with that.
Wow. Thank you, sir. Thank you, sir. And when I saw those pictures of the tissues and the one that looks like saute of beef, I was wondering, could this be in a human being? Wow.
That's not when you bring it into bits that way, so I can come out with the penis, so I don't have to cut the patient open. That was done that's about 7 years ago in one of my patients. Wow. I just got it for teaching. You break it into bits and you bring out, flush it out. The patient gets well. In 2-3 days, you go home. No issue.
Wow. Wow. Well done, sir. God will keep, greasing your elbow. Thank you so much. You have done fantastic tonight. And thank you for opening our eyes and helping us to realize how much, help we can also give to every man around us, and the emphasis we need to lay on this. And please don't forget, Doctor summarized and emphatically mentioned you just have to eat fruits, vegetables, tomatoes, carrots, broccoli. He mentioned all that. He just mentioned all that. I think, and he talked about exercise. I paid attention. I was listening rapidly. Thank you, doctor. Thank you so much. Thank you. Thank you very much. I want to really appreciate everyone on the platform again this evening. Thank you for being a part of today. And let's not forget, it's still the International Men's Health Month. And it's fantastic. Every single day, if you decide to share, a link, this link, once it's shared with you and you decide to share it with a man and the men in your life or around you, I tell you, you are really, really impacting this nation or the nation wherever you are. So thank you, doctor. We really appreciate you, and we say God bless you for taking our time out of your busy schedule to be here tonight. And in the absence of no more questions, I think we might have to just, okay, someone was raising their hand. I don't know if it's to ask a question. I don't know if it's to ask a question. All right. Okay. Are you unmuted? Would you like to say what you want to say? I saw your hands raised. Okay. All right.
Okay, he's unmuted. He's unmuted.
Okay.
You should just unmute him.
Okay, please just unmute yourself if I saw your hands raised and you wanted to ask a question. And if you're shy, you can leave it in the chat box. You can leave it in the chat box. Okay. Should we just call it a day? It's like maybe the question has been answered after all, because he's been raising that hand for a while. Maybe the question has been answered. All right. Okay. I can see another one. saying, okay, one more. Doctor have come to realize that most of our hospitals don't have specialists to treat the, oh yes, oh yes, oh yes. Doctor mentioned that as well. And he
The
mentioned,
treatments are available. The most important thing is to get them early.
yes, sir.
Our wish is to have them early.
Yes, sir. Yes, sir. I'm sure everyone had noted that and they have heard it.
Good evening.
Good evening, sir. Yes, sir. Your
Yes,
name,
ma'am.
sir?
My name is Bayo.
Yes, sir.
I'm sorry, I got this link rather late and I joined not too long ago. I don't know whether the doctor has spoken to my concerns, but I just want to mention that I have some questions.
Yes,
Can
sir.
I go ahead, please?
Yes, please, sir. We still have our professor in
Yeah,
house.
yeah, it has to do with prostate, I think. I
Yes,
have
sir.
normal under 4 PSA results, and my doctor happened to be a surgeon, and I've been told that I don't need their services, but I happen to have some kind of pain in my groin area, which after I've done a scan and even what's it called, this CT, the scrotum is fine, but during the scan, I was told that there's some tissues or something like that in the lower scrotum, and maybe that is the reason for my what do you call it, intermittent pain. It's not regular; it comes and it goes. So that was told to me by the doctor that took the scan, but the doctor that referred me said I don't need any treatment, but I'm on Destorides and what's the other one? Tamsuline. So, doctor, I don't know whether I still need any other thing excepting those ones, but I still feel the pain intermittently. Thank you, sir.
Thank you so much, sir. I believe Professor is with you. Yes, sir. Dr. Tim. Hello, Dr. Tim.
How old is he?
How old, sir?
I'm 62 years old.
Lovely. Now, have you done your PSA?
Yes, he mentioned he did it that it was below 4, but that he's
That's
still
okay.
having a pain.
If he continues with the drug and is
Yes.
satisfied with the result he's getting from the drug, that's okay. If he's not satisfied, that prostate might probably will need to be removed. But if he's satisfied with the drug, the result he's getting, it's okay to continue the drug. The 2 drugs he mentioned are okay.
Yes, doctor.
Normally, ordinary enlargement of the prostate should not cause pain. Ordinary enlargement of the prostate should not cause pain. Now, one of the commoner things that causes pain on passing urine, if you have infection or you have a stone in your bladder, so let them do a scan and confirm that you don't have a stone in your bladder. Ordinary enlargement should not give you. When you have a pain, there's a problem somewhere that should be addressed.
Okay. Okay, doctor. Thank you, sir.
Yeah.
Thank you so much. Yes, sir. And someone is asking if you could recommend any federal medical centers. But it depends on their location. Maybe they just want you to recommend where they can take this treatment if there is prostate cancer already.
Like we said, it depends on the location. Now, it also depends on the state of the malignancy. First is to, wherever you find yourself, approach the federal medical centers. If you don't have the facility, they will advise you on how best to get cured.
Yes, sir.
We must not do all once you come, the most important is to give you the appropriate advice. Then you seek care from wherever they direct you to.
Okay, sir. Okay. He said his location is Lagos. But I
Okay.
don't think I think doctor is in Nnewi.
Yes, I'm in there.
Yes. Yes, sir. Okay. To round it off for the evening, it's still a question pertinent, and the person said, you mentioned some supplements that how is it relevant to help with this prostate gland?
We have said in the treatment of prostate enlargement, there are some phytotherapy. Phyto means treatment from plant roots, herbs that have been found to be useful. Like I said earlier, most of these phytotherapies come from mainly US, and they contain some agents, and one of them is saw palmetto. And I've said saw palmetto have been found to be effective, or rather reduce the risk, because it does some of the functions of the drug we use. One, inhibition of 5-alpha reductase. Two, anti-inflammatory. Three, anti-androgens. These are the things we require in the management of prostate enlargement. So, in that circumstance, some supplements may help. But of course, one will now know what is in the supplements. That's what matters. If we know some of these agents that we can have, there's none I know in particular I can now say, look, go and buy this drug or don't buy this. Look as if I'm marketing for anybody. But basically, we found some plant roots to be, to some extent, help in prostate enlargement. And I listed them in my slide, but like I said, the commoner one is saw palmetto that we know. They've been studied and they are used.
Stand and very direct. Going to shrink prostate enlargement. Of course, Dr. Tim Mbairi has already mentioned fruits and vegetables will help you. And now he's also emphasizing on that phyto, so the phytonutrient. So I believe the onion will also be of benefit. It will be of benefit. It might not totally shrink, like he mentioned. There are different. You need to take the test to know what your status is. You just have to do it yearly. Thank you, Dr. Uzoma. Thank you so much, Dr. Tim Uzoma Mbairi. Thank you so much for the evening. We really appreciate you. The questions are also helping us to get. We won't leave here if we are taking the questions again and again tonight. But I tell you, the ones we had has been very, very enlightening and very informative. Thank you so much. So I want to say thank you to the organizers of this event, the Power Team. Thank you so much. Being led by a person that's Dr. Clementi Digo, Professor John. Thank you so much. Thank you for everyone behind the scenes to ensure that this event was being put together. Thank you so much. And also the Happy People's Group, thank you so much. All our technical team behind the scene, we really appreciate you. All our guests for the evening from all over, thank you, from Abuja, from Lagos, Lekki, Bonny Island, from Canada, from everywhere that I'm seeing here, Zambia. Thank you for making the evening a bright one. Don't forget, watch out for the space again, wherein we will still be reaching out in the International Men's Health, since the month is still very much ongoing. Want to appreciate you, and this is where we'd like to stop this evening. And don't forget, I've seen some emails sent already. I believe that the technical crew they've taken note of that. But if you still didn't get a response on time, don't forget to quickly share yours with the person who invited you. I believe the link, once it's been disbursed out, it will also get to you. Thank you so much, everybody. And we want to say, God bless you all. And let's not forget, I think we can unmute ourselves to say thank you to Dr. Tim before he leaves us for the evening. Can we all do that while we call it a day?
Thank you very much, Doctor.
Thank you, Dr. Tim.
Yes, sir. Thank you, Dr. Tim. Thank you, sir. Thank you, sir. So God bless everybody. Thank you so much for being a part of the evening. We'd like to say good night from here. And let's watch out also for this time, same time next week, where we'll still be, talking around the men's health. God bless everybody. And thank you. Good night. Yes, thank you to our host. Thank you, everybody.